Artimax is a revolutionary, fast, easy, and highly accurate model and die making system. With this system, you can save large amounts of time, money, and maximize the accuracy of your work. The Artimax articulator lets you keep the important advantages of a traditional method and at the same time leads you to a totally new level of convenience and precision. This is a perfect solution for triple tray impression and works well with other impression techniques also. The case is mounted with the bite exactly as the doctor took the impression. Artimax was developed after extensive research involving dental technicians, lab managers, and lab owners. Each was asked to express their opinions and needs for a better disposable dental articulating system, and Artimax was born. The following tape is about 25 minutes long and will fully detail the many benefits of the Artimax system, based on this table which identifies all of the components of an ideal disposable dental articulator. Artimax is more accurate. The Artimax articulator is composed of only two pieces, the upper tray and lower tray. An articulating hinge is already built into each tray. To easily connect the hinges of the articulator, hold the trays parallel to one another and snap the hinges gently into place with your thumbs, one hinge at a time. Die stability. The foundation of the accuracy of your work comes from die stability. With Artimax articulators, you never need to worry about die sway problems or die rotation problems. These problems are eliminated by the combined function of hexagonal struts, brass dowel pins, and short corrugated walls in Artimax. Take a look at these struts on the bed of the lower tray. The six-sided hexagonal design offers superior internal retention of the segmented dies. Bigger struts are allocated for molars, and smaller struts are for bicuspids, canines, and anteriors. Each pinhole is exactly in line with a set of retention struts, so as long as pins are not cut during sawing, two retention struts will always be intact. Therefore, even the smallest dies will not have any mesial or distal movement, since they have at least one pin and two internal retention struts under them providing complete stability. Artimax is basically designed for a pinned model. These tapered brass dowel pins are the most widely used pins currently in the market. The pin is inserted and positioned tightly in the plastic hole without any room for movement, eliminating the use of any pin sleeves needed in other pin systems. The plastic walls of the pinholes work the same as conventional pin sleeves. Plus, there are no additional costs for pins, as pins are included with all Artimax articulators. The combined function of these hexagonal struts, corrugated walls, and metal pins prevent any mesial or distal movement of master dies. With this unique design, even the smallest teeth will have as much stability as the molars. This feature is especially essential for long bridge cases where no die sway problem is a must. The second most important factor of an accurate crown is from closed bite auto articulation. The essence of this widely known technique is that when both upper and lower casts are separated from the impression, they have been automatically articulated, with the bite exactly as the doctor took the impression, by the accurate, stable, and built-in hinge of Artimax. Just pour the stone, close the articulator against the impression, let it set, and open it. It's that simple. This is the fastest and most accurate way to get exactly the same bite your dentist has provided, since you don't separate the cast from the impression until the stone sets. Do you still do this? Old methods that use separate hinges take more time and often produce an incorrect occlusal relationship. Sometimes true bite is very deceiving and challenging even to the experienced technician. Don't try to guess the bite with hand occlusion or hand articulation, which very often leads to wrong bite and creates many subsequent problems. Compared to this old, conventional way, this method we call closed bite auto articulation has long been recommended by dentists and experienced technicians as the best possible method to get the true bite. The bite secured this way presents an exactly identical bite provided by dentists, making it possible to avoid any misarticulation. The automatically articulated bite exactly matches the bite registration that doctors usually send together with the case. The prime objective of this method is to utilize the bite registration as well as the impression recorded on both sides of the impression tray. Studies show that labs receive an average of less than 3% of incorrect bite impressions. In this case, incorrect bites can be adjusted in less than 1 minute, and we will show you how later in this tape. Artimax is faster. In this tape, we will call this side of the impression that has a prepared tooth the prep side, and the other side the opposing side. The prep side always faces the lower tray. In other words, whether the prep tooth is an upper tooth or lower tooth, the lower tray always receives the prep side of an impression. If both upper and lower teeth have been prepped at the same time, connect two lower trays together. To begin, trim the impression with scissors or a knife for both prepped and opposing sides so that the height of the impression is about 3/4 of an inch. Now the impression slightly touches both upper and lower tray. Let's start by pouring the opposing side first. This is easier than starting with the prep side. Pour lab stone or base stone both on the opposing side of the impression and on the upper tray. Invert the impression onto the upper tray. If the impression is small, you don't need to fill the whole tray with stone. When inverting the impression onto the upper tray, place it so that the center of the prep tooth is aligned with the center of the lower tray. Since Artimax has only one row of registration pinholes, it is important to keep this in mind. Here are some good examples. This will ensure the metal pin is placed at the center of a prep tooth. Before the stone sets, clean away excessive stone with a spatula and wipe off the surface of the tray with fingertips for a clean look. Next, with a red marker, mark the center of the prep tooth on the impression, and then on the lower tray to help locate the corresponding pinhole for the prosthesis die. Once you have had some experience with this product, you can easily omit this process. In rare cases with a small tooth, the red marking that represents the center of a prep tooth does not correspond exactly to pinholes. But pinholes are close enough to safely absorb any slight deviance from this red marking. The maximum deviance is only 2 millimeters or 1/16 of an inch. That is exactly the same thickness as a nickel. There is always an appropriate pinhole allocated for even a small tooth, like bicuspids, without deviating far from the center of a prep tooth. This deviance is almost negligible considering you can see through to the metal pins and avoid the pinhead when sawing. This is a good example of where the lab technician's point of view has been given full consideration in the development of Artimax. Next, insert the metal pins into the holes corresponding with your markings. Push the metal pin until it pierces the thin membrane at the end of the pin hole. This membrane is one of the most important features of Artimax. We will cover the benefits of this membrane further in this tape. Pour the die stone on the prep side of the impression using the vibrator. Then put the appropriate amount of die stone onto the lower tray in which pins have already been inserted. The best way to put the die stone on the tray is to cover the pinholes first without vibration. Dab gently in a small motion to spread evenly. At this stage, you may vibrate just slightly to spread out the stone evenly. Please make sure to have a sufficient amount of stone between the impression and the tray. Not enough stone may cause the articulator to spring open later. Now invert the lower tray over the impression filled with die stone. Before the stone hardens, clean away excess stone with a spatula. This will substantially reduce your grinding time later on. Wipe off the surface of the tray with fingertips for a clean and professional look. After the stone hardens, open the articulator. Again, use sufficient amount of stone between the impression and the tray. Not enough stone may cause the articulator to spring open. Grind off extra stone when needed, particularly on the lingual side. This grinding is minimal compared to what is required when using a conventional die making method. Now you are ready to cut the die. Dowel pins are easily seen through the transparent tray body, so there is no need to worry that you might touch or saw the pin while sectioning the die. Use an air gun to clean the stone dust produced from sawing and wiggle out each section die. With the Artimax articulator, you do not need any devices or extra tools to remove the die from the tray. Section dies can easily be removed from the tray bed since there is no excessive gripping power from stones stuck in pinholes. Since all die stones expand, the longer you wait for your die to harden, the harder it is to remove the section dies from the tray. So wait the least amount of time your stone needs for setting. Your trim master die will look like this: pins in the center and corrugated walls intact. There is a soft hold between the dies and tray provided by retention struts, pins, and short corrugated walls, ensuring maximum precision and stability. These grab the section dies gently, creating a much easier release and less forceful grip. This is one of the strongest points of Artimax articulators. With a little experience, you too can make this beautiful and professional looking die in less than 5 minutes. Artimax has a short learning curve, and we are confident that you will be very pleased with this product. Artimax is easier to use. As you have seen, the Artimax method does not separate the models from impression until they are articulated. It requires much less grinding compared to the conventional way. It does not need model-based trimming. It eliminates the need for separator applied under the die. It does not need the pin setting process. It does not need harmful glue or accelerator. There are no expensive pins and sleeves to purchase. There is no second stone to pour, and the hinges simply snap together. All of these unnecessary, time-consuming, and costly processes can be totally eliminated by using Artimax articulators. The articulating hinge. One of the strongest points of this hinge is that it is already built into the trays in a very stable manner. This streamlines the entire work process considerably by eliminating harmful glue, once again saving costly time. This hinge always allows for perfect centric occlusion, as well as excellent lateral and protrusive movements, even after numerous motions. This uniquely designed, sleek, articulating hinge does not have an offset look found in conventional brands. Instead, it presents a natural and symmetrical look. When engaged, the joint area connections are so stable and dependable they are still like brand new, even when a crown is finished. Whereas in some other disposable articulating systems, after numerous protrusive lateral combined movements, the joint area gets very flimsy or even loose by the time the crown is delivered to doctors. Artimax is more efficient to use than other brands. First, air stop membrane. This is one of the most important features of Artimax articulators. The end of each metal pinhole is closed by a thin membrane. This membrane is thin enough to be easily pierced by inserting and pushing the metal pin with fingertips. Therefore, when the semi-liquid stone is poured over these holes that have a thin membrane at one end, air pressure is automatically created, keeping the stone from flowing into the holes and becoming embedded in the tray. For illustration purposes, the air stop membrane on the left side have been left intact, and the right side have been eliminated. This patent-pending design increases work efficiency and eliminates problems routinely encountered with other brands. Here are two important examples. First, there is no excessive gripping force of the pinholes, so segmented dies are very easily separated from the tray bed without extra tools at an initial stage after being sawed. In other brands, dies are not released so easily. They either have to be broken off the numerous pinholes which stubbornly hold the section dies, or the entire stone model has to be released by force using extra tools. Second, dies do not need to be broken to be released at an initial stage of die removal. So there is no possibility for stone debris or dust to sit between dies and tray bed. Plus, you can have a clean tray bed during the entire work process. As you will be able to see, this assures that segmented dies sit completely and firmly in the tray bed. Therefore, no more high occlusion problems with Artimax. In other brands, broken parts of the stone embedded in the pinholes constantly get in the way of complete setting of the dies and continually give off stone debris or particles which lie on the bed of the tray. This can create an imperfect sitting of the prosthesis die and adjacent dies, which is the main cause of high occlusion and increased chair time grinding by your dentist. Do not suffer the headaches of using any model and die making system that does not allow an easy initial die removal from the tray or a perfect die sitting. Second, thumb cavities. This design is another departure from the norm. These cavities facilitate the removal of the pin from the pinholes, and thus the removal of the prosthesis work from the die at the initial stage of porcelain buildup. When the wet porcelain is not in solid condition before the first bake, the buildup is fragile. Thus, the thumb cavity allows the technician to push up softly and smoothly on the tip of the pin. This design is also helpful for subsequent engagement and disengagement of the master die to and from the tray during the entire work process. Hold the master die softly with thumb and index finger of one hand and press up gently with the thumb finger of the other hand. Artimax is more versatile. 1 minute bite adjustment. When the patient did not bite down correctly, it takes less than 1 minute to adjust the bite. Just simply soften the articulating arms of either the lower tray or upper tray using a micro torch or lighter with a very fine tip flame for about 15 to 20 seconds. Be careful not to overheat the articulating arms. While the arms are in soft condition, adjust the bite by hand. Hold the articulator still until the new bite